enemy stays between you and me unless you're going to hurt yourself, someone else, or a child's being harmed. If a child's being harmed, I am a mandated reporter and I have to report that. If you tell me you're going to hurt yourself or someone else, we need to come up with a plan of how we're going to keep you safe. Okay?
Mm-hmm.
As far as telehealth goes, it's kind of unique in this situation. I can control privacy on my end. It's just me, and you might see my dog running around. But it's up to you to control your environment on your side to make sure it's a quiet, private environment.
Absolutely.
Okay. Do you have any questions so far?
Not really. I know I'm not really consistent. So I don't know right now. I don't know if I have much to say, but sometimes I do. And but therapy isn't available at this time. So I don't know. So I'm kind of, I'm not sure where to begin with you, but I feel like I have a massive complexity in my life. And so I don't know. I don't really know. I've been looking for therapy for the last 8 months or so, or maybe even longer than that. And yeah, I don't know. I just keep on running into not conflictions, but just inconsistencies with therapy, because I don't know if it's just because I'm only allotted like 45 minutes to an hour a week or every 3 weeks and such. So it's kind of like opening the can of worms and not getting to all of them. And so it kind of drives me crazy before and after therapy, because I'm so tired of saying it and then not being able to continue or finish. So I don't know. I don't know if I don't know what that says to you or anything, but it's just, yeah, I don't know.
When you say inconsistent, do you mean like you show up inconsistently once you realize what's going on, or?
I mean like my mood swings, or my or just, I don't know, my attitude. And
okay.
You know, I don't know. I don't know what to call it. I don't think it's a chemical imbalance or anything, but I just it's more like just I knew exactly what to say before, but now that I'm on the spot, it's like, well, how do I articulate myself effectively, because there's just too much to talk about. And so I don't know. And that's kind of where I'm at.
Okay. My other question for you is going to be, do you feel like you need more support than once a week? Are you saying like one time a week is not meeting your need in the past?
I think yes. And yeah, I mean, it just depends on where we're going. Because I keep on running into people who are just like, okay, well, I wouldn't say that they say it's too far, but my psychiatrist asked me to stop cursing. And I was,
I don't care if you do.
Okay. Well, I mean, so it's just like, I don't know how am I going to really let go and tell the truth. And if I keep on running into, I'm making my therapist uncomfortable or something, whatever. And so it's like, so that's why I'm trying to find just like the perfect match, because I'm not sure if it's like, I don't need people to agree with me, but it's like, I need them to understand me. And it happens very little as time goes on in my life. And so I'm just really not sure what to do. But I'm stuck in a real fucked up situation. But like I said, I'm just trying to get the ball rolling so I can just kind of start spilling my beans. But I don't really know exactly if we're the right combination or whatever. Who is the combination for me? Go ahead though, please.
Well, I was just going to say, we can try it. And if you feel like I'm not a good match for you, we can look at how do we increase services to the level that you need. The next step up from like outpatient at Genova would be like an IOP program where it's 9 hours of therapy per week. So if you feel like you need more support than just the 1 hour per week, we can look at that. It's totally up to you if you want to try with me first and then go to that step, or if you want me to just research options for you and give you those options. I am fine with whatever you decide. I want you to get the support that you want and need.
Sure. And knowing exactly what I want and need is another complicated thing. And so I don't know. I feel like there's a lot of discussion before discussion starts with me, and that seems to eat up a lot of time too. I just but I don't know. I've been at it for quite a while. Yeah, and I don't know. I don't know really how to start. So I'll give it to you if you have any more questions. But I mean, we have our time right now, so we can see how far it gets. But yeah, I mean, I think I do need some. I need some focused people to think with me. Like I don't know what I mean by that, but it's just if I would put it in a simpler way, it's just I lost all. I feel like I lost all my friends recently, and not just from silly high school fucking silliness or anything. I'm not even in high school, whatever. But I'm saying like my friend died. I was let down by a friend. I let down people. I don't know. And I'm usually a well put together person. What you see right now is a far cry from where I was about a couple years ago, and even last year. But I got rocked really hard. That kind of set me off really bad. Cratered me. I don't know if just would hold me, but I can't stop like crying. I can't stop like hating my life. And I guess you could say my psychiatrist said it's passively suicidal. because I'm not going to hurt myself, and not planning on it, but I really fucking hate myself, and I'm constantly telling myself to die, and just like whatever. It's getting so much to the point, like I say it over and over again every day. Every day, every time I get that intrusive thought, I just fucking hate myself. I fucking hate my life, and I just do it over. And so it's like it's taken over me. So I feel like when I do some internal searching, there's something I can't describe to anyone. So everybody just thinks that I just need to take a walk or something. But really, though, there's something inside of me that's just like screaming. So I don't like waking up with it, and I can't sleep, and I don't know. So I don't know. I have to play psychiatrist myself, and I just kind of chalk. I'm a reasonable person. I'm not fucking crazy, but people would probably argue that I'm I don't know. I don't know what people think about me, but for some reason I can't keep friends. I can't keep people interested that want to continue. And which I don't care. I'm fine being a loner. I don't know what I'm saying. I'm just kind of going off though. But something inside of me fucking hates living, and I've lost enthusiasm for anything, and I'm just disenchanted with the possibility of good things happening. Like fuck off. And that's kind of like where I'm at. And so I don't know. And I don't intend to set out with this pessimistic point of view, but like, I feel like if anybody asks me enough questions and figure out what's going on with me, they'd be like, fuck, I understand. And which they usually do. And so, I get vindicated a little bit, but I mean, it doesn't help. I don't know. And so that's where I'm stuck right now. And last thing I'll say is I tell my psychiatrist is I don't want to be medicated because I don't think it's a chemical imbalance. I just think it's situational of misfortunate events concaved on each other, and then I healed from my childhood, and then something else came and annihilated my progress. And so I don't know. So that's why I don't know. That's why I don't know. I don't know how I'm gonna move forward because I've already been here before, rock bottom, and I don't fucking want to try anymore. I don't want to do the work anymore. I'm ready to get hit by a fucking truck. And like, so it's like I'm saying, I'm not gonna throw myself in front of a truck, but wishful thinking is overwhelmed me. So that's what I don't know.
So you're currently not taking meds?
No, not since last time I talked to the psych.
Okay. Did you feel like they helped in any way when you were taking them?
The first, he had me on the lithium at first. Those were making me faint and dizzy. So it moved me to Wellbutrin and something else. But I don't like, I can't say I don't like the feeling of it. I'm not sure, like, because I have taken them and like, yeah, I don't really like the feeling, but it's not like something, but I just don't like taking them. I don't think that's my problem. And I think if anybody spends a little time with me and realizes like how fucking down to earth I am, like I'm not, so I don't think I'm a person that needs to be maintained or whatever, suppressed. But I mean, I don't know. Go ahead. I'm talking too much, but that's basically.
You're totally fine.
Yeah.
You're totally fine. You're helping me kind of understand what's already happened, what you've already kind of done and tried that hasn't been successful. And it sounds like it's like a domino effect. Every time you go back up, something bad happens and you fall back down.
Yeah.
Making you feel defeated and not wanting to try. Am I grasping that piece a little bit?
Yeah, that's the general thing. I mean, that's the way we can sum it up. But I mean, yeah, I mean, I somehow I feel like I'm never really able to articulate it fully, and it's not like I'm looking for a reaction from anybody, but it's like, I don't know, I hate the sound of it when it gets chalked up to something, but yeah, I suppose. I don't know. I don't know where I don't know. I can't get it out, and I don't know what needs to happen, but I don't know. I'm sorry.
So when you think of like goals for therapy, what are you hoping to get out of therapy?
I don't know anymore, because I mean, I want to feel better, obviously. I don't know anymore. I feel like I feel like I don't care. So I mean, can you make me care again? Because I don't. And
I can't make you do anything, to be honest with you.
Well, I mean,
I know what you mean. I mean, I think you probably need more support than once a week would be my best guess.
Mm-hmm.
But I don't know if your schedule allows it. Are you working right now?
No, I'm as free as a bird right now. I'm probably gonna live in my car here pretty soon. So it's like it's not. If it's just, I don't know. I got a lot to say. Like I got a lot hanging over my head right now, and I don't know. And it's like, people say that. People say I just got so fucking busy. I can't even articulate what's going on. Like we have to we have to go through that whole can of worms together and identify them, and because they're moving around, and it's just like how do you keep your sentence together and so, I don't know. So, but I don't know. It's hard, and I have no one to talk to about it, and so that's why I'm here, so I can talk about it. And I'm actually hoping to. I'm taking my own notes right now so I can find what's wrong with me, because I'm angry. I'm very angry at what's happened to me and my family, but more personally, just me lately, and it just makes me so angry, and I have no one to talk to about it. So I don't know. I seem crazy, and well, maybe not to you, but no one wants to talk to a guy that's just fucking sad. And I'm online trying to talk, like on YouTube and talking, where all these just different Discord, just places to try to find people who want to fucking talk, and I can't find anybody that wants to get on this page with me. And so I guess that's why I'm doing therapy, because I have to pay someone to have this conversation with me. And it's like, because apparently being Gatlin is too fucking unique, so like no one can grasp their head around it. So I don't know. I feel like it's the Truman Show sometimes, because it just feels like everything is just way too complex for the simple question. And so I don't know. I can't accomplish anything anymore.
Tell me a little bit about what's going on that you feel like you're going to be homeless. I'm just trying to figure out like where we can go with as far as like identifying goals, and if I feel like you need more support.
What does more support look like?
They're intensive outpatient programs, so those are 9 hours of therapy per week.
I don't know. I mean,
so it would be more, the IOP would be more therapy based. So there would be a group aspect, there would be individual aspects, there would be skills, like skill based stuff that you would work on. They kind of do all the rounds, and what people like is it's intense and faster than doing 1 hour a week for however long. So they feel like it's more effective in the moment with like kind of maintaining and managing them and helping them like figure out some coping skills. But meds are not required.
Okay. Well,
that's a personal issue. Okay. Like that is not forced upon you.
Well, that sounds interesting then, because in the past, just talking therapy, like I don't know, I've talked to like 5 different therapists, and honestly, the only person that I've really gotten good feedback from was my psychiatrist, which he only wants to talk to me for 15 minutes. Like he only wants to talk about medicine, and like, which sucks, because I think he's a pretty cool guy, but he's also the guy that asked me to stop cursing. So it's, I don't know how much I can push anybody. I can't push anybody because I need to get pushed though, and that's why. So I don't know, and I don't know what I need, but I feel like there's a certain therapy I need, because I need to say some things and whatever, but I don't know what type it is, and that's why I'm trying to say that there's a lot of elements that I need, and I need to talk about, because I feel like I'm shattered, and I don't know, I don't know how to explain it, but more therapy, focused therapy sounds nice, because like so what I was saying is like I get started with this, like I'm talking to you, and I remember the last lady I was talking to, I mean, she just became a little too Mother Goose for me, and it's just like, so I think I'm just a special case. I'd argue that maybe fucking skilled psychiatrists might want to bid on who would want to take my case, because I feel like it's juicy. I think it's interesting. Maybe my narcissism talking, I don't know, but you notice I haven't said shit yet. You don't know what's going on with me, but it's just because I can't get to it, because it's like I'm tied up. And so I understand what's going on with me, but no one else does. And so that's why I'm looking for just professionals just to point and say, I know what's going on with him. And so I don't know. So whatever the direction of that is, I feel like that would probably help me out.
I don't know. Do you feel like you need the 9 hours a week? Like,
is that what I'm describing to a certain effect? Like, because I'm giving you my optimism, what I hope it sounds like, but I mean, is that what it is?
I mean, it just sounds like you want more support than you've gotten so far, and I know I can't offer more than once a week. Mm-hmm. So if we want to look at more than once a week, that would be IOP. Okay.
I mean,
and I can get recommendations for my team. I live in Tucson, so I know nothing in Phoenix, Chandler area. But I can ask my colleagues like what their recommendations are of IOP programs up there. I know there is Charlie Health, which is an online IOP program if you prefer online, or we can look at some in-person ones depending on what you prefer.
I mean, I'd be open to both. I think I looked into Charlie, and I don't know if I ruled it out for some reason. I can't remember why. Maybe it was insurance related. But I mean, yeah. I mean, if the ball can get rolling, because I'm not that, for as bright as I am, I'm not really that smart. Like when it comes to paperwork and doing stuff or finer details, it doesn't really hook with me. So I do appreciate anyone that would hold my hand and get me to the place where I'm going, because like I'm kind of floating and lost. But yeah, I don't know. I'll try anything right now.
And just so I can kind of aim towards the right kind of program. Are you wanting a program that works with like sexualized behaviors? Are you wanting like trauma program? Like where do you feel like you fall? Because I've heard you mention a couple things, because you mentioned some grief and loss, which would put you in the trauma category.
Yeah.
But I also heard you mention some sexual stuff.
Yeah. And it not like serious sexual, but we can put in sexual behavior, but just psychiatric. I don't know how to explain it, but it's like, it's not even anything embarrassing. It's just personal. And, but I don't know. I don't know. I guess I'm too much to ask for someone with like with a, what do you call that thing? Jack of all spades, or whatever. Just someone that can just do a little bit of everything. Like, I don't know. I don't need a whole lot, but I have just a snowball of just shit, and I don't know.
Okay.
So I don't know. So yeah, I just want to touch base in different places. I'm not just trying to focus on one thing.
So it makes me think probably we aim more for the trauma piece.
Okay.
And they might be able to swoop in the sexualized stuff as well. It doesn't sound like it's negative sexualized behaviors.
No, it's just no.
Just a factor in your life.
Yeah.
Okay.
And I don't know. So I don't know. I mean, I don't know. I'm not sure if you're curious. I'm just whatever. I talk about it all the time just for it to kind of feel like an echo chamber. But I don't know. I'm trying to just give you the nutshell of just what's going on with me, if I can, or I don't know if you're interested, or if you have time, or whatever, or if you have any questions. I'm not sure if I can clear anything up for you. But just basically the last thing that's bothering me. It's so 2 years ago this month. At the end of the month, my best friend passed away.